In this video we are going to discuss about the gluteal region and hamstring muscles. That is nothing but we are going to discuss about the posterior compartment of the thigh. In the upper region you have gluteal region and below you have the hamstring muscles, right? These are the extensor muscles of the thigh. So let us see first the bulkiest muscle, that is the gluteus maximus. So its origin is from ilium bone, sacrum, coccyx and also sacrotuberous ligament. So I'll show in a diagram, you'll understand it, okay? So and its insertion is to 1/4 attached, especially its 1/4 part is attached to gluteal tuberosity, which is also called as third trochanter of the femur, and the 3/4 part is attached to the iliotibial tract. So I'll show you in a diagram. So you can see here, this is the bulkiest muscle, that is the gluteus maximus, which is coming from the ilium, also from the sacrum and also from the coccyx. And also you can see this yellow ligament here, this is called as sacrotuberous ligament. So these are the points of origin for this gluteus maximus. So where it will go and insert, I will show you other diagram. So here you can see this yellow color one is the gluteal tuberosity. So 1/4 part of gluteus maximus is attached to this gluteal tuberosity. And this gluteal tuberosity is also called as third trochanter of the femur bone. So here you can see it is mentioned as iliotibial tract, this one. So for this, the 3/4 of the gluteus maximus will go and insert. So already in the diagram I have showed the iliotibial tract. So what is it actually? It is the modification of deep fascia of thigh. So the deep fascia only modified, and this iliotibial tract gives attachment to two muscles, one in the front and one in the back. So the muscle which is attached in the front is tensor fascia lata. I'll show in the diagram. So you can see here the muscle which is attached on the front is the tensor fascia lata, and the muscle which is attached on the back is the gluteus maximus. So you can see gluteus maximus is attached in the back, tensor fascia lata is attached in the front. So this gluteus maximus is supplied by inferior gluteal nerve, whereas the tensor fascia lata in front is supplied by the superior gluteal nerve. So once again let us revise the iliotibial tract. It is a modification of deep fascia of the thigh. It gives attachment to two muscles, one is in the front, one is in the back. The front one is tensor fascia lata, the back one is gluteus maximus. So gluteus maximus is supplied by inferior gluteal nerve. Tensor fascia lata is supplied by superior gluteal nerve. Now let us see the actions of the gluteus maximus muscle. So as you can see, the gluteus maximus, it is passing back of the hip joint, right? So any muscle which passes back of the joint, it is useful for extension. So I'll show the diagram. Here you can see the gluteus maximus muscle, it is back of the hip joint. As it is back, it is doing extension of the hip joint, okay? And also it does the lateral rotation of hip, which is a prime lateral rotation. So it also does lateral rotation. Why? Because the tensor fascia lata is on lateral side of the hip side, okay? So because of this, it is doing prime lateral rotation. So these are the two actions of the gluteal region, especially gluteus maximus muscle. So now we will discuss about gluteus medius and gluteus minimus, okay? So this gluteus medius and gluteus minimus are getting their origin from the ilium bone, same like our gluteus maximus, okay? So where this is getting insertion? So actually the anterior surface of greater trochanter will give insertion to gluteus minimus, and the lateral surface of greater trochanter which will give insertion to gluteus medius. So for this also I will show the diagram. So in this diagram you can clearly see this is the gluteus medius and this is the gluteus minimus. So they are also coming from ilium like gluteus maximus, but this gluteus minimus and gluteus medius will go and insert into the trochanter of femur. I will show that. In this diagram you can see the lateral surface of the greater trochanter. So to the lateral surface of greater trochanter, the gluteus medius will go and insert. And here you can see the anterior surface of the greater trochanter. So to this anterior surface of greater trochanter, here attaches the gluteus minimus muscle here. So once again let us revise that point. The anterior surface of greater trochanter gives insertion to gluteus minimus, whereas the lateral surface of greater trochanter gives insertion to gluteus medius. So actually there exists an angle called as neck shaft angle. Especially in adults it's 125 degrees. In children it is 160 degrees. I'll show you that angle now. So you can see this one is called as neck shaft angle. This one, it is 125 in adults and 160 in children. Let us check out the posterior view of the femur upper side. So in the posterior you can see the attachment of different muscles like the piriformis, which is attached above, and the tricipital tendon is attached over here. That is from, actually the piriformis is attached from a projection which is coming from lesser trochanter, and the tricipital tendon is attached below it, and completely below it there is a fossa like structure where the obturator externus is attached. So here we'll check out like in the posterior view what are the tendons, what are present, their structures. So as I said, the tricipital tendon is attached on the posterior view just below the piriformis, right? So this tricipital tendon, nothing but it consists of gemellus superior, obturator internus and gemellus inferior, okay? And above this tricipital tendon there is a obturator externus insertion which I have shown, right, especially in a fossa, and inward of great toe, inward movement of greater trochanter will give insertion to piriformis. I already showed in the diagram, right? So now let us check out the nerve supply of the gluteus minimus and medius. So both the gluteus medius and minimus are supplied by superior gluteal nerve, and if you see the gluteus maximus, it is supplied by our inferior gluteal nerve, but the gluteus medius and minimus are supplied by superior gluteal nerve. The superior gluteal nerve mainly supplies three muscles. So in total you can say that it supplies gluteus medius, gluteus minimus, and also it supplies the tensor fascia lata, right? So if you remember, tensor fascia lata is in front of the thigh, right? That is in front of the iliotibial tract, right? So this is supplied by superior gluteal nerve. So now let us see what is the main action of our gluteus medius and minimus. So this both muscles are useful for medial rotation and abduction of the hip. So medial rotation means bringing the thigh towards the medial side, and also abduction means abduction of hip. So bringing the hip away from the medial side, that is abduction of hip. So it also have another function, that is it stabilizes the hip joint, mainly acting from below, and it prevents the sinking of pelvis on unsupported side. So for this we need to understand this diagram. So in a normal person, you can say this is a normal person, this is the hip, and this is the right leg, and this is the left leg. So this is in an abnormal person where there is a problem with superior gluteal nerve, because I already said the gluteus minimus and gluteus medius muscles are supplied by superior gluteal nerve. So if there is any problem in superior gluteal nerve, then these muscles will get paralyzed. As these muscles are getting paralyzed, actually these muscles have their effect on opposite leg. For example, if the right leg gluteus minimus and medius get paralyzed, then the left leg there will be problem in the left leg, that they will be unsupported, the left leg will be unsupported. So that is the problem here. But in this diagram you can see the gluteus medius and minimus are proper. So because of this, the left leg, when you lift it in the air, it will be in the air, it will not get pulled by gravity. And you can see the right leg is in the grounded side. So there is one sign called as Trendelenburg sign. In Trendelenburg sign, what happens is the superior gluteal nerve is injured or affected. For example, here we took example of right leg. So in right leg, if the superior gluteal nerve is affected, then the gluteus minimus and medius muscles will get paralysis. So because of this paralysis, in the left leg, when you are trying to raise your left leg in the air, you can't, because the gravity is pulling here down, and your gluteus medius and minimus are not giving any support to this leg. So this is the problem here. So you can see here clearly the sinking of pelvis on unsupported side when the patient is standing in paralyzed side. Patient can stand on the paralyzed side, but he can't stand on unsupported side, okay? So you can take an example here, like a 20-year-old male with pelvis sinking on right side, and the Trendelenburg sign is positive, which is sound side. Which is sound side means which is normal side. By this question only you can easily understand the right side is normal side, because it is, they are saying with the pelvis sinking on right side. So clearly you can understand now. So right side is unsupported, so it is paralyzed. The gluteus medius and minimus are affected. So what is paralyzed? Left side is paralyzed. Left side is paralyzed, right? So gluteus medius and minimus are affected, and superior gluteal nerve is affected. So sound side, that is the normal side, is our right side. So once again, let us revise all the muscles which are attached to the greater trochanter. If you can remember, the greater trochanter, especially on its lateral side, there is attachment of gluteus medius. On its anterior side, there is attachment of gluteus minimus, and there is attachment of obturator externus in a fossa on the posterior side. Tricipital tendon is also attached on the posterior side above this obturator externus insertion. And you know the tricipital tendon contains the gemellus superior, obturator internus, and gemellus inferior, and also the piriformis muscle is attached to the the lesser trochanter, which is projecting on the posterior side. So this is all the summary of the muscles which are attached to the greater trochanter. And the muscles which are attached to the lesser trochanter is also important, that is only our iliopsoas muscle. So in this diagram you can see here, this is the iliopsoas muscle which is attached on the lesser trochanter. Now let us start our understanding with linea aspera. You can see actually on the posterior side of the femur you have a line-like structure that is called as linea aspera, and it is having a medial lip and lateral lip. Actually its medial lip is continuous with the spiral line. You can see here it's mentioned as spiral line here. So this spiral line is nothing but it's a continuation of the medial lip, and the lateral lip continue as the gluteal tuberosity on the lateral side. In the middle you have the linea aspera. That is one, that middle one is called intermediate lip. Okay, so it is having three lips: medial lip, lateral lip, intermediate lip. Okay, so now let us see the theory which is related with it. So linea aspera, as I showed already, the spiral line, it is nothing but the continuation of medial lip, and it gives attachment to pectineus muscle. So pectineus muscle is actually a muscle of anterior compartment and also the medial compartment. It's an hybrid muscle, right? So remember the spiral line, which is a continuation of medial lip. It is all this linea aspera is on posterior aspect of femur, right? So this gives attachment to pectineus muscle. And next, coming to the lips. So like as I said, medial lip, lateral lip, intermediate lip. Let us see the attachments. So vastus medialis is attached to medial lip. So I said, let us draw the diagram. So this is linea aspera, this is the medial lip, this is the lateral lip, this is the intermediate lip. Okay, and this medial lip only will continue as spiral line, and this lateral lip will continue as gluteal tuberosity here. So medial to medial lip, this is medial lip, so medial to it here, exactly here, there is attachment of vastus medialis muscle. Okay, and in the medial lip it gives attachment to the medial intermuscular septum. Okay, and here in the middle, that is the intermediate lip, there is attachment of posterior intermuscular septum. And one more thing, between this medial lip and intermediate lip, there is attachment of two muscles. You can see here adductor brevis and adductor longus, and also adductor magnus. So the adductor muscles are in between the medial lip and intermediate lip. So in the intermediate lip, along with the posterior intermuscular septum, there is also attachment of short head of biceps femoris. Okay. Now coming to the lateral lip. Lateral lip gives attachment to lateral intermuscular septum, and also vastus lateralis is attached. So you can draw a line here. This is vastus lateralis, which is attached lateral to the lateral lip. So this diagram you need to understand. So once again, let us revise all the structures which are present in an order. So medial you have vastus medialis, and this is a medial lip. Medial lip will give attachment to medial intermuscular septum. Okay, and after that there are some muscles like adductor muscles, adductor longus, adductor magnus, adductor brevis. Next, intermediate lip will give attachment to posterior intermuscular septum and also short head of biceps femoris. Okay, after this you have lateral lip, which gives attachment to lateral intermuscular septum, and also lateral to lateral intermuscular septum there is attachment of vastus lateralis. So that's it. So this, if you can draw this line diagram, you will remember everything. So you can see here the sequential arrangement of structures in linea aspera. First you have vasti medialis, next you have medial intermuscular septum, next you have adductor muscles like adductor brevis, adductor longus, adductor magnus. Next you have the posterior intermuscular septum. After that you have short head of biceps femoris. Next you have the lateral intermuscular septum, and finally you have vasti lateralis. So this is the order of muscles in a linea aspera, which is present in posterior side of your femur. So let us check out other muscles which are present in gluteal region. For that we need to check out the diagram. In this diagram you can see this is the sacrum, right? And there is a ligament coming, that is a sacrotuberous ligament, and you can see here A, B, and in between the sacrospinous ligament, sacrotuberous ligament, this is ischial spine, this is ischial tuberosity. So you can see the structure A, which is a greater sciatic foramen, and B is the lesser sciatic foramen. So let us see what are the structures which are passing in the greater sciatic foramen and lesser sciatic foramen. So as you saw the diagram, you can say that A is greater sciatic foramen and B is lesser sciatic foramen. So let's see what are the structures which are passing through greater sciatic foramen. So first one is piriformis muscle. If you remember, the piriformis is attached to the posterior side of the greater trochanter. As I said before, I showed the diagram also. So piriformis is actually a key muscle. Okay, it's a key muscle in a greater sciatic foramen. So why it is a key muscle? Because the vessels which are passing through it is important. Above piriformis, so I'll draw this also diagram. This is greater sciatic foramen, this is lesser sciatic foramen. So in middle like this you have the piriformis muscle. It is a key muscle. So above piriformis there are some structure and below piriformis there are some structure. Let us find out. So above piriformis there is superior gluteal artery, as it is above superior, okay, superior gluteal artery and superior gluteal nerve. Next, below piriformis, inferior gluteal artery and inferior gluteal nerve, and also below piriformis only there is sciatic nerve, and also there is posterior femoral cutaneous nerve, and there is also nerve to quadratus femoris, there is nerve to obturator internus, there is internal pudendal vessel, there is pudendal nerve. So these are all the structures which are passing below the piriformis. So if you observe, above the piriformis just you have superior gluteal nerve, superior gluteal artery. Okay, below the piriformis you have many structures, like about total 7 structures, along with the inferior gluteal artery and nerve. Okay, so inferior gluteal artery and nerve, sciatic nerve, posterior femoral cutaneous nerve, nerve to quadratus femoris, nerve to obturator internus. So how to remember them? Sciatic nerve everyone knows, so it's easy. Inferior gluteal artery and nerve also you can remember. So next remember just the posterior femoral cutaneous nerve. Next remember the nerves to 2 muscles, that is the quadratus femoris muscle and obturator internus. So for this 2 nerves, and you have internal pudendal nerve and also internal pudendal vessel and internal pudendal nerve. So pudendal nerve and pudendal vessel. So very easy to remember. So these are the structures which are passing below the piriformis. Next, let us see the structures which are passing through lesser sciatic foramen. So this is a greater sciatic foramen, this is the lesser sciatic foramen. So lesser sciatic foramen passes the tendon of obturator internus. Only the tendon passes, not the muscle, that is important. So the tendon of obturator internus passes here, and the other one is pin structures. So what are the pin structures? P for pudendal nerve, I for internal pudendal vessel, and N for nerve to obturator internus. So as the tendon of obturator internus is passing, you can remember that now also nerve to obturator internus is passing, internal pudendal vessel is passing, and pudendal nerve is passing. These two are again, they are also passing in the if you remember, and below piriformis in the greater sciatic foramen there are pudendal nerve and pudendal vessel, right? So you can relate this and you can easily remember them. So this is about the structures which are passing through in the greater and lesser sciatic foramen. Now you can see the root values of superior gluteal nerve and inferior gluteal nerve. Superior gluteal nerve is coming from the dorsal division of L4, L5, S1. This you need to remember. From L4, L5, S1 means here the lumbosacral plexus. This is a lumbosacral plexus. From the dorsal division of L4, L5, S1, you get the superior gluteal nerve. And inferior gluteal nerve is from dorsal division of L5, S1, S2. So just next to it you can remember, the inferior gluteal nerve is next to it. Just omit the L4 here, just add S2 here. Okay. So both are dorsal divisions. Superior gluteal nerve from dorsal division of L4, L5, S1. Inferior gluteal nerve from dorsal division of L5, S1, S2. That's it. So now let us move on to sciatic nerve. Sciatic nerve is actually having 2 components. One is the tibial component, one is the common peroneal component. The tibial component is coming from ventral division. So coming to the common peroneal component of sciatic nerve, it is coming from dorsal division of L4, L5, S1 and S2. So now let us see what is the root value of posterior femoral cutaneous nerve. It is also coming from dorsal division of S1, S2 and also from ventral division of S2 and S3. So this is about the sciatic nerve and its components. Okay. And now let us see the nerve to obturator internus. Into this nerve to obturator internus, it supplies the obturator internus muscle and also to the superior gemellus muscle. Okay. Uh, and one more thing, the nerve to quadratus femoris, it supplies, according to the name you can see quadrata femoris, and also it supplies the inferior gemellus. So that thing you need to remember, in the case of nerve to quadrata femoris, it supplies inferior gemellus. Nerve to obturator internus, it supplies the superior gemellus. Okay. And the piriformis muscle is supplied by fibers from S1 and S2, that is the sacral plexus. As said, the piriformis is a key muscle, it is supplied directly from sacral plexus, S1 and S2. So the muscles which I have discussed till now are all the lateral rotators of the hip joint. So there are all the lateral rotators of the hip joint. Along, of course, the lateral rotation, the main one is our Gluteus Maximus, of course. The supporting muscles are piriformis, superior gemellus, inferior gemellus, obturator externus, obturator internus, quadratus femoris, sartorius muscles. So these are all the accessory muscles which are assisting the gluteus maximus for the lateral rotation of the hip joint. Okay. So we have completed the gluteus muscles. Now we'll move on to the hamstring muscles. So actually all these hamstring muscles are coming from ischial tuberosity. I'll show you a diagram now. Before showing those muscles, I'll show this muscle, the piriformis muscle. You can see over here, this one is the piriformis muscle. Okay. So these are all actually the cadaveric images. You can see here the obturator internus muscle. This one is the obturator internus muscle. So in this diagram you can clearly see the different components which we have discussed just now. So this upper one, this is actually the cut part of gluteus maximus. Even here you can see this is the cut part of gluteus maximus muscle, and this is the gluteus medius muscle. This is also cut part of gluteus medius. Okay, and here you can see the piriformis muscle, and this is a nerve to quadratus femoris. As I said, it supplies the quadrata femoris and also it supplies the superior gemelli. So you can see the nerve to quadratus femoris, which supplies the quadrata femoris and also it supplies the inferior gemellus. Okay, and you can see the different muscles in this diagram itself, like the gluteus maximus, already discussed, gluteus medius, and this you can see this is a piriformis, right? So above piriformis there is superior gluteal nerve, below piriformis there is inferior gluteal nerve, right? So you can see here this is the inferior gluteal nerve and this is the superior gluteal nerve. So above piriformis superior, below piriformis inferior gluteal nerve. And you can see the nerve to obturator internus. It supplies the obturator internus muscle and also it supplies the superior gemellus, right? So one thing you need to remember, that superior gemellus is supplied by nerve to obturator internus. Inferior gemellus is supplied by quadratus femoris nerve. Okay, so that thing you need to know. And this thickest nerve you can see yellow color, this is the sciatic nerve, this is the gluteus maximus cut end, and this is the posterior femoral cutaneous nerve. And next you can see the pudendal nerve also here, this one, this is the pudendal nerve. And so I think we have covered all the diagram. Okay, so as I said about the Tindelberg sign, you can see here this is a normal side, like where the nerve is affected. This is a normal person. In this paralyzed person you can see the person can't put this leg. Try to find out what are the muscles which are mentioned in this diagram. So here A represents the, so here A is the cut end of gluteus maximus muscle, and B is the gluteus medius muscle, and coming to C is the gluteus minimus muscle, and coming to D, that is the tricipital tendons, and E coming to the quadratus femoris. So here E, this is a quadratus femoris. So let us check out some cadaveric images. Here you can see this is the gluteus medius muscle, and here you can see this is the gluteus medius, this is the superior gluteal vessels, this is the gluteus minimus, this is the piriformis, this is the tricipital tendon, it is quadratus femoris, this is sciatic nerve. So as I said, all the hamstring muscles are originating from the ischial tuberosity. This is ischial tuberosity. It is divided into quadrangular part and triangular part. Okay. So you can see this is a quadrangular part. This is A, B. In between there is a line, oblique line, and this C, D. So let us see what are this. So you can see here A. This A is nothing but it's an upper lateral part of quadrangular part of ischial tuberosity. Here it gives origin for semimembranosus muscle. And you can see here B, which is a lower medial part, which gives origin to semitendinosus and also long head of biceps femoris muscle. And next coming to C, Next, coming to C, you can see C is the lateral part, which is a hamstring part of adductor magnus, which is attached here, and D is the medial part where there is no muscle attached, but there is sacrotuberous ligament attached. So now let's check out the theory which is related to hamstring muscle. So origin is from ischial tuberosity as I shown it, okay, and the insertion is it is inserted into bones of leg, that is either to tibia or fibula. This hamstring muscles will go and attach. So what is the main action of this hamstring muscle? You can see this hamstring muscles are crossing the hip behind, means they are crossing back of the hip, so they'll do hip extension, and they're crossing knee behind. So as I said already, for the knee it's different. If they cross behind the knee, it will do knee flexion. So I already shown in the diagram the ischium is divided into upper quadrilateral and lower triangular part, okay, and how upper quadrilateral is divided into A and B and lower into C and D. I'll show that and also discuss this, okay. We'll see the theory also. So this hamstring muscles, the posterior muscles of the thigh, are supplied by tibial component of sciatic nerve. Remember the tibial component, okay, and the Trendelenburg sign, if you see on the normal side and parallel side, I showed the diagrams also. This is about diagrams. So next, coming to this ischium, where they are attached in the A, that is in the upper lateral part, there is origin of semimembranosus, okay, and in the lower medial part there is origin of semitendinosus and long head of biceps femoris muscle. Whereas if you see in the lateral part, there is a hamstring part of adductor magnus, this is attached, that is inserted, and even in a D, that is a medial part, there is no muscle attached, but there is attachment of sacrotuberous ligament, okay. So this is about a hamstring muscle. So let us see each of the hamstring muscle one by one. Let us start with biceps femoris. So in this diagram you can check out the biceps femoris muscle. This is the long head of biceps femoris. This is the short head of biceps femoris. Actually the long head of biceps femoris is only called as hamstring muscle. The short head is not called because it is coming from the femur itself, but the long head is coming from the, you can see the long head is a hamstring muscle and it is supplied by tibial sciatic nerve, okay, and the short head is supplied by common peroneal branch of sciatic nerve, and it is not a hamstring muscle because of origin from femur. And you can see the tendon of this biceps femoris, it is attached to the head of fibula, and to the head of fibula, not only attachment of this biceps femoris muscle, there is also attachment of fibular collateral ligament. Now let us discuss about semitendinosus muscle. You can see here this is a semitendinosus muscle. The name itself is semitendon because half tendon and half fleshy. So the fleshy is proximal part and the tendon part is distal part. Here you can check out the pes anserinus muscles. Actually there are three muscles. You can see semitendon, semitendinosus tendon, gracilis tendon and sartorius muscle tendon. So these three muscles together form pes anserinus, which are attached on the you can say like medial side of tibia. So you can see the theory here. This pes anserius muscle, also called as guy ropes muscle, because they originate from the hip bone and insert on the tibia, and these three muscles are acting like a rope and tie the hip bone to the tibia, okay. So what are those three muscles? Sartorius, gracilis, semitendinosus. And next, coming to semimembranosus muscle. Actually this semimembranosus muscle also have two parts. One is the fleshy part and which is distal, and one is the membranous part which is proximal. And this semimembranosus muscle is also attached to medial condyle of tibia, and it has an oblique popliteal ligament which is derived from semimembranosus muscle. I'll show all these structures now. So you can check out, this is a semimembranosus muscle which is coming from, you can see the tuberosity of ischium, and it is attached to the medial condyle of tibia. So its fleshy part is distal but the membranous part is proximal. Here you can see it is having an oblique popliteal ligament which is also nothing but a tendon of, like, it is derived from semimembranous muscle. So finally let us discuss about adductor magnus. You can see this muscle is adductor magnus. This all hamstring muscles, if you see, they are attached to the tibia or fibula, but this adductor magnus is attached to the femur itself, that is to the like you can see to the adductor tubercle of the femur. So how we can say this as like hamstring muscle? Let us clear it out. So what I'm saying you can understand by means of this notes, you can understand, right? So what they're saying, adductor magnus, like all hamstring muscles have attached to either tibia or fibula, but this adductor magnus is attached to femur, that to the adductor tubercle of femur, and it is also called hamstring. Then why we can call it as hamstring? It is not attached to tibia or fibula because the medial collateral ligament, actually it is a primitive insertion of adductor magnus muscle, so it attaches to tibia. Actually what they mean to say is the adductor magnus attaches to the like primitive insertion to the medial collateral ligament, and this medial collateral ligament will go and attach to tibia. So by this we can say that it is also an hamstring muscle because it is attaching to tibia indirectly by means of medial collateral ligament. So I hope you understood this like video. Of course it's long, somewhat long, because we have covered like many parts, many muscles, and like many important stuff here. So if you like this video, don't forget to like, share and subscribe to my channel.